Did you know that pain in the right shoulder can be a sign of a liver problem? What's worse, more than 60% of people with liver disease don't know they're ill until it's too late. Symptoms such as pain, tiredness, and digestive problems may seem simple, but they could be signs of something more serious. In this video, I'll show you 7 strange signs you may be ignoring that could indicate liver damage, as well as practical tips for avoiding complications. Stay until the end because the last sign will surprise you. 1. Right shoulder pain. Pain in the right shoulder can often be dismissed as a muscle strain or a result of poor posture, but it can actually be indicative of more serious underlying conditions, particularly involving the liver. The liver is located on the right side of your body, just below the rib cage, and when it becomes inflamed or stressed, the pain can radiate to the right shoulder. This type of referred pain occurs because of the close proximity of the liver to nerves that also serve the shoulder region. Conditions like fatty liver disease, a condition where fat builds up in liver cells, hepatitis, inflammation of the liver, or even cirrhosis, scarring of the liver tissue, can cause the liver to swell. As the liver becomes inflamed, it can push against surrounding structures, including the diaphragm, which is directly linked to the right shoulder via nerve pathways. This results in a sensation of pain, tightness, or discomfort in the shoulder area. Additionally, lifestyle factors like excessive alcohol consumption, obesity, or a diet high in fats and sugars can contribute to liver stress, which may trigger this type of referred pain. Other symptoms that often accompany right shoulder pain due to liver issues include fatigue, nausea, digestive disturbances, or a yellowish tint to the skin or eyes, jaundice. If your right shoulder pain persists, especially if it's associated with any of these other symptoms, it's important to consult with a healthcare provider. A thorough examination, blood tests, and imaging studies, like an ultrasound, may be needed to assess liver function and identify any potential liver conditions. Early detection and management of liver problems can prevent further complications, including liver failure, and improve your overall quality of life. Light-colored stool. A sudden change in stool color, particularly if it turns pale, clay-colored, or even white, should never be ignored, as it often signals an issue with your liver or bile ducts. Under normal circumstances, the liver produces bile, a digestive fluid that helps break down fats and contributes to the characteristic brown color of stool. Bile is stored in the gallbladder and then released into the small intestine during digestion. However, when the liver or bile ducts aren't functioning properly, this process is disrupted, resulting in a change in stool color. Conditions that can interfere with bile production or flow, such as hepatitis, liver inflammation, cirrhosis, liver scarring, or bile duct obstruction due to gallstones or tumors, may cause a reduction or complete halt in bile secretion. Without bile, fats in the stool are not properly digested, and as a result, the stool may appear pale, clay-colored, or even white. This change in stool color can be one of the first noticeable signs that something is wrong with the liver or biliary system. In some cases, light-colored stool may also indicate a blockage in the bile ducts, often due to gallstones or pancreatic cancer, which can prevent bile from reaching the intestines. In these cases, other symptoms may accompany pale stool, such as jaundice, yellowing of the skin or eyes, dark urine, or abdominal pain, particularly in the upper right side of the abdomen. If you notice any persistent changes in your stool color, especially if it's accompanied by other symptoms like jaundice, abdominal discomfort, or changes in appetite, it's crucial to consult with a healthcare provider. They may recommend blood tests, imaging studies, like ultrasound or CT scans, or endoscopic procedures to assess the liver, bile ducts, and gallbladder. Early diagnosis and treatment of liver or bile duct issues can prevent complications like liver failure, cholestasis, or pancreatitis, and improve long-term outcomes. If you're learning more about how to recognize signs of liver problems, don't forget to subscribe to the channel and leave a like. This helps us to keep bringing you important content. 3. Night vision problems. You might be surprised to learn that your liver plays a key role in maintaining healthy vision, particularly when it comes to night vision. The liver is essential for the storage and release of vitamin A, a nutrient crucial for maintaining good eye health. Vitamin A is involved in the production of rhodopsin, a pigment found in the retina that helps your eyes adjust to low light conditions. Without adequate vitamin A, your ability to see in dim lighting or at night can be compromised, leading to symptoms like night blindness or difficulty seeing in the dark. If your liver is damaged due to conditions like hepatitis, fatty liver disease, or cirrhosis, it may not function properly, which can disrupt your ability to store or release vitamin A effectively. As a result, your vision in low-light situations may deteriorate over time. Cirrhosis, which involves severe scarring of the liver tissue, can exacerbate this issue, making it even harder for your body to absorb and process vital nutrients, including vitamin A. In addition to night vision problems, liver dysfunction can cause a range of other symptoms that impact eye health, such as dry eyes, yellowing of the eyes, jaundice, or even blurred vision. If you notice these visual disturbances, especially in conjunction with fatigue, abdominal discomfort, or changes in appetite, it's important to consult with a healthcare professional. Blood tests and imaging studies can assess liver function, and correcting vitamin A deficiencies through supplements or dietary changes may help improve your vision. If untreated, liver diseases that affect vitamin A metabolism can lead to more serious complications, including permanent vision impairment. Early intervention is key to preventing long-term damage, so don't delay in seeking medical advice if you experience persistent night vision issues. Before, swollen right foot or ankle. Swelling in the feet or ankles can be a common occurrence after long periods of standing or sitting, especially if you've been on your feet all day or have a sedentary lifestyle. However, if you notice swelling that's localized primarily in the right foot or ankle, it could be a sign of a more serious underlying issue, particularly related to liver function. The liver plays a crucial role in filtering blood, producing proteins, and maintaining fluid balance in the body. One of the proteins the liver produces is albumin, which helps to keep fluid inside the blood vessels. If the liver is damaged or diseased, such as in hepatitis, cirrhosis, or fatty liver disease, it may produce insufficient amounts of albumin. Without enough albumin, fluid can leak out of the blood vessels and accumulate in the tissues, leading to edema or swelling in areas like the feet, ankles, and legs. This condition is often more noticeable at the end of the day after standing or sitting for extended periods. In addition to the decreased production of albumin, liver dysfunction can also affect the body's ability to regulate fluid and sodium, contributing to fluid retention and further swelling. If the liver is unable to effectively filter blood, pressure may build up in the veins of the lower extremities, exacerbating the problem. Swelling in the right foot or ankle, especially when it's persistent or doesn't improve with rest, should not be ignored. It may be accompanied by other signs of liver problems such as jaundice, yellowing of the skin or eyes, fatigue, abdominal bloating, or dark urine. If you notice these symptoms, it's important to seek medical advice. A healthcare provider may order blood tests, imaging scans, or ultrasounds to assess liver function and rule out more serious conditions like liver cirrhosis or portal hypertension. Increased pressure in the portal vein that carries blood from the intestines to the liver. Early detection and treatment of liver issues are critical in preventing more severe complications, such as liver failure or ascites, fluid buildup in the abdomen. Therefore, if you experience persistent swelling in one or both legs, particularly with other signs of liver trouble, it's best to consult a doctor for further evaluation and care. 5. Yellow skin or eyes, jaundice. Jaundice, characterized by yellowing of the skin and the whites of the eyes, is one of the most noticeable and concerning signs of liver dysfunction. This condition occurs when the liver is no longer able to efficiently process bilirubin, a yellowish substance produced during the breakdown of red blood cells. Normally, the liver filters out bilirubin from the bloodstream and excretes it through bile. However, when the liver is damaged or diseased, this process is disrupted, causing a buildup of bilirubin in the body. As a result, the skin and eyes take on a yellow tint. There are several liver conditions that can lead to jaundice, including hepatitis, inflammation of the liver, cirrhosis, liver scarring, and liver cancer. In these cases, the liver's ability to filter blood, produce bile, and process bilirubin is compromised. When bilirubin accumulates in the bloodstream, it can cause the yellowish discoloration that is characteristic of jaundice. Jaundice can also occur in conjunction with other symptoms, such as dark urine, pale-colored stool, nausea, abdominal pain, or unexplained weight loss. If the yellowing of the skin or eyes develops gradually or becomes more pronounced, it's crucial to seek medical attention promptly. Jaundice often signals that liver function is significantly impaired, and further diagnostic tests such as liver function tests, imaging studies, ultrasound, CT scan, or a liver biopsy may be needed to determine the underlying cause. While jaundice itself is not a disease, it is a serious warning sign that your liver may not be working properly. Conditions like hepatitis or cirrhosis can progress to more severe stages, potentially leading to liver failure, liver cancer, or other life-threatening complications. Early intervention is key to managing liver diseases and preventing further damage. If you notice any yellowing of the skin or eyes, seek medical advice without delay to assess liver function and determine the best course of action for treatment. 6. Spider veins. Spider veins, small dilated blood vessels that appear near the surface of the skin, are typically harmless and common in many people, especially as they age. However, when spider veins suddenly appear on the face, arms, or upper body, particularly in individuals with a history of liver disease, they can be a significant sign of liver trouble. While spider veins are often associated with factors like pregnancy, obesity, or prolonged standing, their presence in someone with liver problems warrants closer attention. The liver plays a critical role in metabolizing and regulating hormones in the body. When the liver is damaged, as in conditions like hepatitis, cirrhosis, or fatty liver disease, its ability to process and balance hormones becomes impaired. This hormonal imbalance can cause an increase in estrogen levels, which in turn can affect the blood vessels. Elevated estrogen levels can lead to the dilation of small blood vessels, resulting in the appearance of spider veins, which often take on a characteristic web-like or starburst pattern. Spider veins are particularly common in more advanced liver disease, such as cirrhosis, where scarring of the liver tissue disrupts normal liver function. In these cases, spider veins may be accompanied by other signs of liver dysfunction, such as jaundice, yellowing of the skin or eyes, swollen abdomen, ascites, fatigue, and abdominal discomfort. It's important to note that while spider veins alone are not definitive proof of liver disease, their presence in conjunction with other symptoms could indicate that liver function is compromised. If you notice new spider veins developing, especially if you have a history of liver issues or risk factors for liver disease, such as heavy alcohol consumption, obesity, or viral hepatitis, it's crucial to see a doctor. Blood tests and imaging studies can help evaluate liver function and determine whether liver disease is present. Early diagnosis and intervention can help prevent further liver damage and improve overall health outcomes. While spider veins can sometimes be a cosmetic concern, when associated with liver dysfunction, they can signal the need for more urgent medical attention to address underlying liver conditions before they progress to more severe stages. Now for one of the most alarming signs. 7. Persistent itching. Persistent itching, or pruritus, is an often overlooked symptom that can be deeply uncomfortable and disruptive, particularly when it occurs at night. While itching can have many causes, when it becomes chronic and doesn't seem to be linked to common issues like dry skin, allergies, or insect bites, it could be a sign of an underlying liver problem. One of the most common causes of persistent itching associated with liver disease is the accumulation of bile acids in the bloodstream. The liver plays a crucial role in producing and secreting bile, a digestive fluid that helps break down fats and eliminate waste products. In healthy liver function, bile is processed and excreted into the intestines. However, when the liver is damaged, such as in conditions like cirrhosis, hepatitis, or fatty liver disease, its ability to process and excrete bile effectively is compromised. This can lead to the buildup of bile acids in the bloodstream, which then accumulate in the skin, causing intense itching. The sensation of itching tends to be more prominent on the palms of the hands, soles of the feet, and sometimes on the arms and legs, though it can occur anywhere on the body. It is often worse at night, making sleep difficult. This type of itching is typically non-dermatologic, meaning it is not caused by external factors like skin irritation, but rather by internal biochemical imbalances due to liver dysfunction. Persistent itching can also be associated with jaundice, yellowing of the skin and eyes, dark urine, pale stools, and fatigue, which are other signs of liver disease. If the itching is persistent and unrelieved by over-the-counter treatments, it's important to seek medical attention. A healthcare provider can conduct tests to assess liver function, such as blood tests to check liver enzymes or imaging studies to evaluate liver structure. In some cases, the itching may be managed with medications to help reduce bile acid buildup, such as ursodeoxycholic acid or antihistamines to alleviate the itching. However, addressing the underlying liver condition is essential for long-term relief. Early diagnosis and treatment of liver disease are crucial to prevent further complications, including liver failure and cirrhosis, both of which can severely impact your quality of life. If you experience persistent, unexplained itching, especially if it's accompanied by other symptoms of liver dysfunction, don't delay in consulting a doctor. Now we're going to share some simple, practical tips for looking after your liver and avoiding complications in the future. Take care of it, and it will take care of you. To improve liver health and optimize vitamin A absorption, you can use the following supplements. Silymarin protects liver cells and has antioxidant effects, helping to improve liver function. Betaine aids digestion and reduces the accumulation of fat in the liver. Berberine helps regulate metabolism and liver function, as well as improving insulin resistance. Glutathione, a powerful antioxidant that detoxifies the liver and improves the body's general health. Resveratrol has anti-inflammatory and antioxidant properties that protect the liver against damage and help it regenerate. Now that you know the 7 strange signs that can indicate liver problems, don't ignore your body. If you notice any of these symptoms, see a doctor as soon as possible to make sure your liver health is up to date. Remember, taking care of your liver is essential for a healthy life. If you liked the video, don't forget to subscribe to the channel, leave a like, and share it with those you like. And of course, comment down here with your experiences and opinions. See you in the next video.